Hello everyone. Welcome back to another OET writing masterclass. If you're struggling with writing a referral letter, discharge letter or transfer letter, then this video is exactly what you need. Today, we are not just going to talk about tips. I'm going to give you a huge real exam style example, break it down step by step, and explain every little thing you need to do in order to score high. So get comfortable, grab a notebook, and let's crack the OET writing test together. So before we jump into the example, let's get some basics out of the way. In the OET writing test, you will get the case notes and you will need to write a letter to a healthcare professional, right? So this could be a referral letter, that means sending the patient to a specialist, or it could be a discharge letter where you are informing a doctor about a patient who's leaving the hospital, or it could be a transfer letter, like transferring a patient to another facility. So, what is your goal here? You need to write a clear, professional letter using only the important case notes. And the biggest mistake students will make here is they copy everything from the case notes without organizing the information in a logical way. But remember, the examiner will check whether you can filter out unnecessary details and you will be able to write a clear, well structured letter. So, step two here is the perfect format that gets you a high score. Okay, there is a format always works for any OET writing letter. The first one is introduction. Who's the patient and why are you writing the letter? So, try to keep it short and clear, like 1 to 2 sentences only. And then comes the main body, right? When we are talking about the main body, most important details that should come in a logical order. So, what is the present history, any medical background, explain the current situation like symptoms, test result, or treatment that has done so far, and you can end with the reason for the referral or for the next steps. And then closing. Closing is like what action do you expect? What action is expected from the person that you are referring to? So, this is the final sentence. So, try to be clear about what you expect from the recipient. All right, let's look at an actual OET writing example. Here is the case notes. Patient name is given Mr. John Smith. Age is 54. Marital status is married, lives with wife. Occupation accountant. Medical history diagnosed with type 2 diabetes mellitus in 2015. Hypertension since 2018. Chronic kidney disease stage 2 diagnosed in 2021. Family history of diabetes and cardiovascular disease, and the current symptoms are fatigue, dizziness, increased thirst, and frequent urination for the past 2 weeks, blurred vision for the past 1 week, numbness in feet for the past 3 days. And also the investigations are given here. Blood sugar, HbA1c is 9.2%, which is poor control. Kidney function test, creatinine 1.9 mg per dl, which is high. EGFR 48 ml per minute. And BP is 160 bar 95 mmHg, which is uncontrolled. And the treatment given increased metformin dosage, started on insulin therapy, adjusted hypertension medication, advised strict diet and lifestyle changes, and the reason for referral: poor diabetes control despite treatment, possible diabetic neuropathy, and worsening kidney function, needs specialist assessment from an endocrinologist. So remember, as I told you, first try to start with the introduction. Who's the patient and why the referral is happening, and the main body, right? Which means the medical history. What conditions does the patient have? What are the current symptoms and the test results or treatment? And finally, end with a closing. What action that you are requesting or expected from the recipient? Try to state it in a very clear way. Got it? So let's see. So you are just, writing Dr. Elizabeth Carter. endocrinologist, Greenview Specialist Hospital, 45 Maple Street, London. March 28, 2025. Dear Dr. Carter, I'm referring Mr. John Smith, a 54-year-old accountant with poorly controlled diabetes, for further assessment and management. His recent symptoms and test results indicate potential complications warranting specialist intervention. Mr. Smith was diagnosed with type 2 diabetes mellitus in 2015 and has been an oral hypoglycemic agent since then. Despite medication adjustments, his recent HbA1c level of 9.2 suggests inadequate glycemic control. He also has a hypertension diagnosed in 2018 and chronic kidney disease CKD stage 2 since 2021. His family history includes diabetes and cardiovascular disease. Over the past few weeks, Mr. Smith has reported fatigue, dizziness, increased thirst, and frequent urination, accompanied by blurred vision for 1 week. Notably, he developed numbness in his feet 3 days ago, raising concerns about diabetic neuropathy. His recent investigation revealed high creatinine levels, 1.9 mg per dl, and an eGFR of 48 ml per minute, indicating possible worsening of his CKD. His blood pressure remains uncontrolled at 160/95 mmHg despite medication adjustments. In response to these findings, his metformin dosage was increased and he was initiated on insulin therapy. His antihypertensive medications were modified and strict dietary recommendations were provided. However, given the persistence of symptoms and the risk of diabetic complication, a specialist review is warranted. I would appreciate your expert evaluation and recommendations for optimizing his diabetes management and addressing potential complication. Please feel free to contact me if additional information is required. Yours sincerely, so you can put your name, and if you have any medical practice, yes, you can put it too. Why this letter works is we have started with the introduction, straight to the point, right? If you see here, referring Mr. John Smith. So, who is the patient? We have mentioned here. And why is the referral happening with poorly controlled diabetes? For further assessment and management, we have given it very clearly. And coming to the main body, right? We have given the medical history. What conditions does he have now? Type 2 diabetes mellitus in 2015, like from the past, and his present symptoms such as HbA1c level of 9.2, and also hypertension, which was diagnosed in 2018, and chronic kidney disease since 2021. So all the medical history has been given very clearly. And if you see, we have also explained the current symptoms, what he's experiencing right now or for the past 1 or 2 weeks, like fatigue, dizziness, increased thirst, frequent urination, blurred vision, and numbness in his feet, right? Diabetic neuropathy. So these details are explained in a very clear and in a logical flow. And finally, test result and treatment, what was done and why. So here we have mentioned metformin dosage was increased and initiated on insulin therapy, right? And finally, clearly we are asking the endocrinologist to assess the patient's case. If you see here, what is expected from the recipient, we are mentioning here clearly. Optimizing his diabetes management and addressing potential complications. And if you see the entire referral letter, you can find no vague statements anywhere. Okay? So remember, filter out unnecessary details. Don't copy every case note. Whatever is required for that patient evaluation or for the referral or discharge letter, only those points you are going to highlight. So try to avoid unnecessary details. Use it formal but natural language. Keep it professional, but it should be readable also. And it should follow a logical structure like past history to the current symptoms, then to the treatment, and for the referral request. So, this is how the flow should be. And try to be clear about why you are writing. because the reader should understand your letter in 10 seconds. And that's it, guys. If you follow this structure, you will definitely improve your OET writing score. I hope this was helpful. If it was, don't forget to like, share, and subscribe for more OET tips. See you in the next video, and good luck with your exam. Bye bye.